The TURNS network stands for the Trauma and Urologic Reconstruction Network of Surgeons. This group was formed in 2010 by a number of young reconstructive urologists across the country that were interested in a research collaboration. Initially, there were 8 centers involved in this effort, which included University of Texas, University of Minnesota, University of Utah, Loyola, among many others. The members of this research group were all fellowship trained in reconstructive urology and all have a very firm commitment to doing high-quality research on the difficult problems that reconstructive urologists deal with. One of the main difficulties we all recognized is that urologic reconstructive problems are rare, and so a single reconstructive urologist at a main academic center has a small experience with some of the more rare problems he or she deals with. Through a large collaborative group, we're able to amass a number of patients so that we can really study these problems in a very consistent and academic and rigorous fashion. For instance, a reconstructive urologist working at a main academic center may only see a few rectourethral fistula per year or even in their career, but combining with 8 other centers, we're able to rapidly amass enough numbers to accurately study this condition and also determine which approaches seem to be the most effective. Another very important part of our group is the collaborative effort. We all push ourselves to do better research, and we all push ourselves to do better surgery. Through collaboration, new ideas are vetted, and we're able to pick up ideas that seem to be more effective. At first, our progress in this group was very slow, and we had several times where we felt the group was falling apart and would not continue as a successful research collaboration. A difficulty in academic research in medicine currently is funding these collaborative groups. The government has cut funding for academic medicine substantially over the last decade or 2 decades due to the increase in healthcare expense and a variety of other factors. It is for this reason that I appeal to you for funding of our research group. It is essential that we obtain private funding of some sort to increase our ability to study these difficult urologic reconstructive problems. If you've experienced urologic reconstructive problems and needed to see a urologic reconstructive surgeon, you know that these problems are difficult to manage, and often information about the problems is not well understood in the greater urologic community or among other surgeons. If you feel that you'd like to give back to increase the understanding about dealing with these difficult problems, then please contact us through our website at the Trauma and Urologic Reconstruction Network of Surgeons. I assure you that any gifts that you give will be well used in the direct study of these problems and the direct benefit of future patients in defining the best practices and the most successful surgeries that we can for urologic reconstruction. Thank you very much, and don't hesitate to contact us if you have any questions about giving to the Trauma and Urologic Reconstruction Network of Surgeons. Your support is essential to dealing with these problems.